Hello, everyone, and welcome to Side Project, our foray into the hellscape that is middle age. I'm Layla Secca, and I'm here today with my very good friend Ruthie. Hi, Ruthie.
Hi, Layla. Good to see you. I'm excited to be here today. And the topic today is something a little bit interesting. We're talking about pain. And the reason we're talking about pain is that Layla and I have had two very different journeys about pain. And we're not just talking about pain like, ouch, I stubbed my toe. We're talking about chronic pain, physical pain, debilitating pain. So, Layla, why don't you tell us about your experience a little
Yep.
bit?
So, about 6 years ago, my hip started hurting, and I went to the doctor, and they said, "You have arthritis in your hip, and you're way too young for a hip replacement. So, suck it up and do PT and lose weight and all these things." And so, for like 6 years, I've been sucking it up. And last year, it got real bad. It got super acute. I was on a cane for 6 months. I couldn't really sleep. And basically,
And
I
this
was
is, you're
in
50 years old, right? You're
Oh,
not,
50 years old. Yeah, I mean,
you're
I'm not
still
like a spring chicken, but I'm not
right, but
grandma, I'm not
right.
75 hip replacement. But here's the thing. A lot of 50-year-olds have hip replacements. Lots of 40-year-olds have hip replacements. Like there's this foray that hip replacements are for your grandma. Well, I'm your grandma then because I have fucking hip replacement, but just the general, I mean, I think the thing for me was I had never been in pain like that. And I'd hurt my knee. I've had surgeries. Like I've been hurt before, but I'd never been in pain that started to like change my personality and change the way I felt about living and like because it hurt all the time. And I was talking to
Yeah,
you that whole time, Ruthie, and you and I were chatting earlier. Tell a little bit about your experience, like you were listening to me, and then what happened
yeah.
to you.
So my pain experience was totally different from Layla's. I have heard her for years talk about how much pain she was in, and it was like, oh wow, Layla's really in a lot of pain, but I couldn't really empathize with her because I had never been through it myself. Well, rewind to last fall when I started going through debilitating pain. I couldn't do anything. I was hard to dress myself. Some days I couldn't get out of bed. It hurt to lift a cup of coffee. It hurt to pull a hanger off the shelf. I didn't feel safe driving because it hurt to turn the steering wheel. And I was eventually diagnosed with an autoimmune disease. So I'm working on it now. But I similarly had some very dark days when you're dealing with pain and you just don't know if there's an end in sight.
Right. So,
So,
go ahead. Go.
well, to that end, I'm excited because today we have with us Dr. Naureen Alim, who is a rheumatologist and immunologist here in Houston, Texas. Thank you so much, Dr. Alim, for joining us.
Thank you for having me. I'm excited.
We're excited to have you. So, listen, I mean, pain is a big topic, right? Because pain happens to everyone in all different kinds of ways, and people react to pain differently, some better than others. But I think generally we can all say that as we move into midlife, pain seems to be more of a rider than she was, say, in our 20s.
Mm-hmm.
And why? Okay, body's getting older, things are breaking down, but like, why do things ache and get creaky? And like, why does my knee like snap, crackle, and pop every time I kick in the swimming pool? And like, what?
So that's the more common type of arthritis. And I always try to explain to patients there's many different types of arthritis, but the one that you're talking about is the most common. That's osteoarthritis. And what's happening is that cushion, that cartilage that is sort of in between the joint space is sort of wearing down. Most likely as a result of age and normal degradation, but then that ongoing friction basically leads to pain, stiffness, and swelling. And that could be, like you said, like due to age, but also genetics. It may be predisposed in certain families, obesity, wear and tear. You mentioned, some people are getting hip replacements earlier. Well, that may be because they were engaged in activities that just put a lot of stress on that particular joint. So even though they were younger. And one of the things that I think, because your podcast is sort of focused on middle-aged women, we and people in general tend to lose muscle mass as we get older, right? And so now you've lost that stability around the joint. Again, another source of stress on that joint. And then because of the way, and that's the main sort of arthritis, but the type that Ruthie shared is a little bit more autoimmune inflammatory. And again, you have a joint, and that's less common, but you have a joint that's now compromised as a result of inflammation. And again, it's going to be more susceptible to that degradation and wear and tear as well, just like if you had an injury to a certain area. So that's it. And just a little fun fact is that, we're not in this alone, because there was a study maybe like a decade ago where they looked at the number one, like the top reasons why someone would go to their healthcare provider for an office visit. And the top three are sort of, number one is skin, number two is just musculoskeletal joints, and number three is back pain. So, it's common.
That's like the stereotypical thing, you throw your back out when you're middle age, when you're old age. It's just so it's like, you turn 45 and it's like, oh, I threw my back out.
Yeah.
I mean, it's all downhill. It's pretty crazy.
So, with pain being so prevalent, right? And as you said, I think everyone I know has some kind of arthritis sprinkled in somewhere at this point, right? And like my sister had a knee replacement. My mom had 2 hip, it's genetic, all that kind of stuff. But the pain component, right? Because often the doctor will be like, take some Advil, take some Tylenol, I get it, but and then he's like, I took Tylenol PM every night for 2.5 years, right? Because I was like, okay, yeah, it hurts and I'm tired. And then only in the last, 6 months was someone like, yeah, maybe no to that one.
Yeah, let's talk about that for a second. Why is that? Can you take over-the-counter pain medicine, kind of ad nauseum? Or is that, I feel like that's bad.
Yeah.
We should not be taking pain medicine every day.
I agree. I do agree. I don't think people should take pain medicine all the time. I think it's, it's helpful if you, like you said, you mowed the yard, or we're in the gym, you felt something, you're going to take it easy, take something over the counter for a few days, that's fine. But if it's ongoing, severe, it's the worst thing you've ever felt, or you're just finding, like you said, Layla, that you're just taking this all the time, and why? Because it's affecting your functionality, it's affecting your quality of life, then maybe we need to investigate, or at least find some alternatives. Because again, not everything is perfectly safe long term.
So what
happened? Is it like your liver? Doesn't it affect your liver?
Yeah, so let me talk about the safety sort of thing first, because one of the sort of misconceptions that I deal with all the time is people think if it's over the counter, it's safe. But then let's talk about, non-steroidal anti-inflammatory. So that's going to be your ibuprofen or naproxen, the other names for it, like Advil, Aleve, Motrin, right? And people are like, it's over the counter, so they're taking it instead of maybe discussing things with their doctor. But guess what? Long-term use of those can actually damage your kidneys. It can raise your blood pressure. So now you're dealing with a cardiovascular issue. And then it can irritate your stomach lining. So then that leads to ulcers and GI bleeds. So that's pretty significant. And we've, as physicians, a lot of us have seen sort of the effects of people just sort of, even young people just popping this stuff and then, ending up with a bad outcome. Tylenol is a little bit safer in my books. But again, a lot of times people say it doesn't work. That's one thing. But even if it does, if you're using it chronically, and at higher doses than recommended, then you might end up with liver issues. So exactly, there's just organ involvement there, even though they're over the counter.
So you've really got to get to the root cause then of the pain.
Exactly.
So that's how you know when you need to see a doctor, is if it's like debilitating, or if you've been on over-the-counter medication too long. It's like,
yeah, if it's severe, it's debilitating, it's affecting the quality of your life, it's different from anything you've experienced. And then I would mention again, because you brought up the autoimmune issue, and this is not going to be as common, but if you have red flags, because there may be other causes of pain, right? So if you have fever or rashes or weight loss, that might be something else going on. Or a common one is, my back hurt or my neck hurts, but now my arm's going to sleep or my leg's going to sleep, or I have numbness and tingling. Now you may be dealing with a pinched nerve, and how serious that is needs to be investigated. So there's lots of little nuances there that, you want to think about when you're talking about pain.
But sometimes with the pain, Naureen, you can't figure out what's wrong, right? My hip hurt and they did a thing and they're like, yeah, you have terrible arthritis and it's going to get worse. Suck it up. But with Ruthie's, there was a period of time with Ruthie where she was like, I don't know what's wrong, Layla. We talk to each other all the time, and she'd be like, I feel terrible and I have so in those situations where you're trying to discover what's going on but you're still in terrible pain, are those Advil times? Or I realize you can't give medical advice and no one's gonna do anything. Don't do anything, Dr. Naureen.
You're not doctors.
Podcast. don't teach. We're just having a chat. Talk to your normal doctor. All caveats aside, all disclaimers. But like, I mean, I guess it's a little hard to know what to do, right? Because it hurts like shit, and I'm stuck, and I can't figure. Like with my doctor, he was like, "I won't fix it. You're too young." And I was like, like I'd go on family vacations, and I'd have to stay in the hotel while everyone went walking around because it hurt too much to walk. Like, though I don't know how to manage, how to think through that kind of pain when the medical profession doesn't necessarily have the answer you need
Well,
right then, right?
Well, I would say that, okay, so you actually, it sounds like you maybe ended up with a specialist who specifically, made the diagnosis and said, hey, I'm not going to do anything at this point because of your age or whatever reason. So there's that group of patients who are undiagnosed. And we sort of talked about those red flags where they may need to go and see somebody seek medical attention, whether that's with their primary care doctor or orthopedics or rheumatology or whatever, right? So that's one group. And then you are sort of in this group where you know what's going on, but maybe you're not a candidate sort of for the definitive treatment. But then there's other things, exactly like you said, and in terms of medications. So there may be, we talked about the over-the-counter stuff, the anti-inflammatories and Tylenol. But then, for example, in my practice, we may use things that, and I'm not even talking about narcotic pain medications, right? Because those, again, they're difficult, they're prescribed by a certain group of physicians and they're habit forming. But even before that, there are certain strategies we can use, medications included. So there's Cymbalta, for example, is an antidepressant, but it's been shown to work for chronic pain. So musculoskeletal pain, back pain. So again, sort of in the appropriate patient, you might use something like that. Or there's a variety of nerve pain medicines, which you can use for the sort of sciatica type pain. And even in arthritis, I'll use it sometimes. Because again, I'm thinking, well, if someone needs pain medication long term, what can I use that might be a little bit safer than Tylenol or Advil Aleve? And that, again, that decision sort of depends on, the specific patient, but those are things that are worth discussing. And then for you, we'll just use you as a specific example, right? Physical therapy, that's a great option, right? You can get injections into the joint. And then there's, I know
Does that work?
very natural
Does
things.
that injection in the joint thing work? I mean, it
The
just feels like a
injections?
big needle. Does it work? I didn't do it.
It's
I was
worth a
scared
try,
of it.
is what I say, right? Everything's
Yeah.
worth a try at least once because you always
Right.
hear the horror stories, right? For people for whom it didn't work. But for all of that, there's plenty of people who do really well. And it serves as a bridge for you till you're, maybe your doctor determines that you're appropriate for the replacement or whatever.
So on that note, let's talk about some of the more proactive things that you can do. I think Layla and I have very specific instances of acute pain, but a lot of people have sort of long-term joint pain. So what about things like supplements? And, now I've been doing collagen and creatine to try to build muscle mass and loosen up my joints a little. Do these things work? Omega-3s, fish oil, all those things that you read about.
So in talking about supplements, and I think you guys had like a weight loss doctor on, and supplements are tricky, right? Because they're not FDA approved, they're not regulated, so you don't know what you're getting from company to company and from batch to batch. Okay, so So for the medical community, it's very difficult to do studies and give you an evidence-based answer as to whether or not something will work. That being said, sort of I look at the flip side. I say, if it's safe, why not? So as long as it's safe, it's not interacting with anything that you're doing, I'm a proponent of trying something maybe once, because again, these things aren't cheap either. So, you might want to try one at a time and see what benefit you get. And I don't know if you'd like me to give you some specific examples. It's not like, you mentioned several,
Sure.
but like one of the things I'll recommend is turmeric, which is essentially the active ingredient is curcumin. It's a spice. It's a natural substance. They formulate it with black pepper. It improves the absorption. And it works. It's a really great natural anti-inflammatory. But again, some people may experience GI side effects with the medication. And then I have to look at the patient's medication list too, because I'm saying, okay, if you're on a blood thinner for your heart or something like that, I'm not going to prescribe this, or I'm not going to recommend this because it can actually thin your blood further. So that's an example of something that works really well, but might not be appropriate for everybody, right? And you mentioned collagen. Again, same sort of thing. Not a lot of data, but it suggests that it may be because it's sort of like, trying to replace that cushion. So collagen, fish oil, all of these things have either been shown to help with arthritis pain or reduction of inflammation. Another one is glucosamine chondroitin. You may have heard of that. Like OsteoBiflex is a common brand that people talk about. But essentially, again, it's the same thing. And they've looked at it in various studies for knee pain and and it's like, it doesn't work. But it is so safe and so free of side effects that I think it's worth trying, because I think everybody wants to see if there's something out there that's not a medication. So I think it's fair.
What about like topical things like, icy hot and biotherm and I think I have every brand possible in my bottom drawer because I tried every single thing.
Yes,
like,
arnica,
similar
capsaicin, you name it, rubbing a little spice on your leg. Yeah, it all, it's the same thing. Again, no data, but they're all safe. And so it's definitely worth trying. And since we're talking about topicals, we can even foray into non-medication things, right? Like massage and physical therapy, I mentioned, even acupuncture. Not great data out there, but there's no harm in worth trying to see if it alleviates your symptoms.
It is funny, as we've been going through this whole thing, and we ask everybody about supplements just because, who doesn't want to just take a pill and suddenly be better, and a pill that's not even medicine. But my sister-in-law texted and she said, I feel a little like a science experiment these days, because it's like, oh, take this, take this, take this. It's like, I've got my 20 supplements that I'm taking every morning now.
Exactly. And there's a pill burden associated with that, right? Like, you're trying to do all of these things to sort of quote unquote help yourself. You don't have great data, and then you're taking a handful of pills, which, what are they doing? Like, how does that make you feel to take all of that medication? So, I try to simplify things for people, and it's totally up to the patient, right? Like, because we don't know how beneficial this is, if you're motivated, you're more likely to go through that trial and error process.
Yeah, I've pared way back. Like, I was taking all the supplements, and now I'm really kind of taking none, because it's like,
I did that.
Who knows? I mean, and who knows if they're working or not? So if I'm taking 20, then how can you tell which one is actually working?
Right.
So
I would do one at a time.
Complicated.
Definitely.
Yeah.
It does seem like inflammation is our new enemy. Inflammation and trying to eat as much protein as a full cow daily, which is side of my forte. I like a hamburger, and no way I can eat that many hamburgers. But inflammation, like Ruthie and I were chatting about this earlier, like, are there foods that are anti-inflammatory? Like, what should we be doing to deflame?
Yes.
That's a new word. Okay,
I would like to know how I can deflame my body. Yes.
Deflame my body.
Okay.
How do I do that?
That's a question I get asked a lot. And it's a little tricky because there is just a lot of information out there. There's a lot of diets out there, and it's sort of akin to the supplement conversation, right? Not a ton of data, and it's just hard to do studies on diet or food specifically. But I would answer this the way I would sort of explain it to my patients. So of all the things that are out there, if they're really motivated, if the person in front of me is really trying, and I think that's a great idea because, I think taking a holistic approach to your health is very important. It's very empowering. But I also don't like to be too restrictive. So I'll normally suggest, hey, why don't you start with gluten and like refined carbohydrates and refined sugars. So natural stuff is okay, but try to avoid the gluten and sugar as much as you can, because in terms of just the sort of whatever little evidence we have, that seems to be the most implicated in terms of inflammation. And then depending on the patient, if they're super motivated, they may go and then experiment with, there's lists out there, right? So they may experiment with dairy, red meat, nightshade vegetables. So that's going to be like your eggplant and tomatoes and things like that. And they may come back and give me some feedback on how they did. But it's hard for me to really tell them to not eat all of these things because I think that's just really hard to do. And also, even with things like the Whole30 or an autoimmune protocol, all that stuff that's out there, I do believe that when you do it, because it's essentially healthy living, that people feel better. But it's very difficult to sustain long-term. And you're talking about, we're talking about middle-aged women specifically, like that's your target audience. And so think about it, you've got your kids, you're taking care of your parents, and you've got meals to put out. And now all of a sudden you're being extremely restrictive there and thinking about different people's dietary needs. So we have to be a little bit practical and try to do these things in conjunction with Western medicine. But I definitely I do encourage patients who are motivated to do that.
I would definitely did that. I was very motivated. I couldn't get out of bed. And it's like either you change your diet or you stay in bed for the rest of your life. And so now I call myself vegan plus salmon. And
Yes.
I've gone my whole life. Like I would say I could never be vegan because I can't give up eggs. Well, when you're in debilitating pain, it's like, fine, I'll give up eggs. I'll give up cheese. I'll give up whatever you want me to. And it's definitely helped a lot. I think dairy is a big trigger for me.
See, and so you've
Gluten's
kind of
tough, but-
figured exactly, and you may have found that maybe gluten wasn't. So it's different for different people as well. So I think that's a great point, is trying to figure out what it is for you.
Mhm.
And some people have this really dramatic response like you did, Ruthie, and some people just don't. Or they think they don't, they stop, they reintroduce the food, and that's when they realize, oh, wait a minute, I was actually feeling much, much better when I wasn't. So there is a little trial and error there as well, definitely.
Yeah, I mean, I was very strict about it for about 6 weeks, and it was tough. But honestly, I've never felt better.
Good.
So that, I mean, that's a good motivator. So when you actually feel good and you feel healthy, it's like, okay, there's something to this.
It's worth it.
You're feeling more normal, right? I mean, you're like almost normal, right?
I do. I mean, I am also taking medication, and I think the two things together have really helped.
Yeah, absolutely. And I had a hip replacement, and now I'm
I wasn't told that.
happy. Because I wasn't like I will honestly say, even my friends were like, Layla, your mood is changing, because I was in pain all the time, and I was even like things I loved, like my kids or having things that I enjoyed doing. Just I didn't really enjoy them as much because it hurt all the time. And so I mean,
that goes back to like that's the reason to go see your doctor, right? Like, I mean,
Right,
if you're
right.
if it's affecting your mood and your mental health, I think that's we should put that in the list of reasons to go talk to somebody.
Yeah, absolutely, absolutely. I was talking to him, just nothing was happening. I don't
But
think
it's
I was being
hard. Again, it's hard because you're kind of going through this by yourself, even if you're talking to the doctor. Because even when you say, I'm in a lot of pain, I mean, I couldn't explain it to people how much pain I was actually in. And you don't want to be that Debbie Downer who's like, oh, look, Ruthie's always in pain.
right.
You know, so it's very isolating.
Well,
it's-
and we
it's
grew up with
very
the
dark.
And we grew up in the suck it up generation. Suck
Yeah.
it up.
Yes.
Suck it up. It hurts. Suck it up. You don't like your job? Suck it up. Like,
And it's true
suck
for
it
women
up.
too, right? Like you're busy, you've got a lot of things, and actually that's another point that you just made me realize is that it's not just suck it up. It's sometimes you just don't have the time because you're caught up with so many things that you put yourself last. And that often then actually escalates the issue. So I think that, we have to be cognizant of all of these things that you just mentioned.
Yeah, 100%.
So midlife arthritis is coming for people. I mean, I'm already there, right? But arthritis is knocking on the door for most of my friends and all of us. That's your specialty. That's like what you do, right? So like with that kind of where we are, like what would you give a healthy person who doesn't really think they have arthritis, but is moving into that age bracket where it's coming? Like, what are like your 3 pieces of advice, right? Like, here are the 3 things if you want to try to keep your joints healthy and try to minimize the arthritis impact of what is coming with inevitable aging of the body. Like, what are your 3 magic, like, here are the 3 things you got to do, you got to think about all the time?
So it's not supplements.
Right.
Sorry. But no, I think like this is so, because I take care of autoimmune diseases as well, I don't just take care of patients who are older and sort of dealing with just osteoarthritis. I have a lot of young patients who have autoimmune disease in their 30s. And the things I say to them, I think is applicable not just to the sort of autoimmune inflammatory arthritis, but to osteoarthritis as well, which is, hey, basically it's all summarizes into, being healthy overall. So in terms of foods, you don't have to be too restrictive, try to be whole, natural, and organic if you can, as much as possible, try to use the 80-20 rule there. And then 2 and 3 are kind of similar. Like I really encourage patients to walk because that's, a form of, and essentially for exercise. So I encourage exercise, but I always at least say, walking, because that applies to any age group. It's sustainable. It's not super injury prone. You can do it anywhere in the world. You don't have to have access to a gym, right? So that's one thing. But then for my young females, especially, I do definitely say start the weight training now. Start picking up those weights. That is super, super important. Those days of just sort of being cardio all the time is gone. There is a shift for all of us women to really incorporate muscle and strength training because, again, so many benefits, as I'm sure you guys have heard from other people along the way. But from my perspective, it's joint protection, it's stability, it's improving your, movement, keeping you active for you to be able to do things and increase your longevity.
100%. 100%.
That's great. I've lost so much of my muscle mass. I mean, I need to start working on that again ASAP. I couldn't even lift my bag into the overhead bin
Yes,
last time I flew on
exactly.
an airplane.
Okay, I got
That's
some.
a real issue.
I got something I started, and this is a little off topic, but I'm just gonna bring it up. I found this gym, and it's called High Intensity Training, and you only go for half an hour a week. I mean, I just want everyone to realize they don't let you come more than half an hour a week, and you work out with the trainer, and you do like 5 reps as slow as possible. And I gotta tell you, I'm in the best shape of my life. And half an hour a week. Like, I hate the gym. I hate it. I hate being around other people working out. I don't like working out. I sweat all the time. I got no interest in it. But half an hour a week, and I've seen a difference. So this new high intensity weight training thing, I'm very excited about this. This is my new rave that I'm into. So, but
yes, it has to be something you enjoy as well and something you'll keep up with. So that's a plus.
right. And half an hour a week.
Sort of a more basic question, which I should have asked earlier, but can you just at a basic level, what's the difference between osteoarthritis and rheumatoid arthritis? I mean, I know they're very different, but like, what's the root difference there?
Ruthie, I just made a reel on this actually, but yeah, it was just ironic that you asked me this question. So it's all fresh in my head. So
you're very prepared.
So osteoarthritis is what we just kind of have been talking about in general, right? With aging and wear and tear of the joint, and we don't fully understand the mechanisms. Rheumatoid arthritis is going to be sort of more your autoimmune inflammatory. So where, this isn't the best way to explain it, but I think the simplest way is that there's something in your immune system that's dysregulated and that's quote unquote attacking your joints and causing that inflammation and joint damage and joint pain and so on. So the features are different as well. So when someone comes into my office and I'm interviewing them for the first time, I'm also trying to figure out, what is it that they have? Do they have normal 50-year-old hip arthritis, or is this something like autoimmune systemic inflammatory? So kind of just, again, using the two of you as examples. But, osteoarthritis, it's going to be pain that gets worse with activity, pain that's, kind of more towards the end of the day after you've been up and about using that joint, for example. If you do have stiffness is normal, sort of that gelling phenomenon where you sort of get up and you're creaky and you got to move around a few steps before you get better. That's what we call stiffness. And that may last, up to 30 minutes is usually normal. Generally, it's going to be around 15 minutes. And you can have joint swelling. Less common than, let's say now on the rheumatoid arthritis side, it's going to be predominantly small joints, multiple joints, lots of stiffness, especially in the morning. So like maybe 30 minutes to an hour to get going. You'll have sort of that red hot swollen kind of joint feeling. And then there may be other features, like that's what I had mentioned in the beginning. Like you may, have low grade fever, rashes, or other things that suggest that it's more than just your hip or your knee. It's something more systemic.
It's a little bit of a bummer that it's the same name because they're very different.
Yes, the arthritis component. Yes, exactly. Yes. And everybody and most people use the word arthritis. And yes. We're left to sort of figure out, well, what is it? Is it rheumatoid arthritis or osteoarthritis? And let's not, there's a whole host of autoimmune diseases that I treat. But what, gout is another form of arthritis. And then some people have heard of lupus, right? And that's an autoimmune disease and that has arthritis as a component. So you're absolutely right. The terminology is sometimes difficult for someone who's not
problematic. Yeah, absolutely.
Yeah, it's hard. This is hard. Like, I don't like this part so much. Like all this parts of aging, but the like creaky joints and the weird, like inexplicable, unbelievable pain that doesn't end. Although mine ended, and I'm very grateful for that.
Yeah, that's exactly. That's a different kind of
thing. Are there any golden tickets for managing acute pain? I mean, other than medication, are there, is there anything that we wouldn't have gotten online? Like as a medical professional, like, heating pads,
Yeah,
long baths,
that's
sauna,
exactly.
whatever.
Yeah, I
Are
was
there
just
like,
thinking that exactly. So the debate of hot and cold is still there. So I just tell patients go with what feels better most of the time. But I find in general patients like heat. So I'll say heat, rest, and if you like, the common acronym for when people have like a tendonitis, you guys have heard of tennis elbow and things like that. So it's rest, ice, compression, elevation. So you can try all of those things. We talked about some over the counter, like, the stuff like Bengay, but there's also over the counter topical anti-inflammatory. So you're not taking the medication by mouth. Now those are available. And so there's all kinds of patches and things like that that you can try. And this is not really acute pain per se, but, water-based therapies and aquatic therapy is also a great way to sort of treat and maybe prevent joint pain. So those are some things that you can try as well.
That's amazing. Do you have arthritis, Naureen?
So I think I do have the creaky knees, okay? And sometimes a bum shoulder. And so I always tell my patients, I say, do as I say, don't do as I do, because sometimes I'll push through that in the gym. And you really, you should listen to your body.
Right. You're
So
classic.
I'm in the same age group, you guys. So I mean, we're all there. I'm also like, now starting to take a little creatine before I go work out, and I might try experimenting with some of these supplements that we mentioned. But I just hate taking stuff. So I'm just like, what else can I do?
Experiment too.
Yeah, exactly.
Well, I think that's a good place for us to stop and wrap it up today. Big thanks to Dr. Naureen Alim for joining us today. You can find a recap of everything we talked about on our website at sideprojecthq.com. And you can also learn more about Dr. Alim on her Instagram, which is Fitness Room. That's her handle. So Fitness Room, it's not room like ROOM, a room. It's room, RHEUM, like rheumatology. Fitness Room. We'll link to it on our channels as well. So Naureen, thank you so much for joining us. This was awesome and a totally inspiring conversation. And I'm gonna go start lifting some more weights.
That's right. That's it. That's all we got to do. Thank you.
You're amazing, Naureen. Thank you so much. That was awesome.
Thank you so much.